What's up with you, Precious? I and my teammates are here to talk on the combination therapy in the treatment of ulcer.
Generally, the etiology, which is the cause or origin of ulcers, are not known, but it could be as a result of the imbalance between the aggressive factors such as bile, gastric acid, H. pylori, and what have you, and the defensive factors such as mucus production, gastric mucus production, basically prostaglandins, and what have you. Duodenal ulcers in this case now are ulcers that occur on the duodenum, which is the first part of the small intestine. They are characterized by gnawing and burning of the upper abdomen, which occurs between meals or at night. Then gastric ulcer, also known as stomach ulcers, are ulcers that occurs in the stomach, and the presentation is mainly gnawing also and burning sensation, which occurs while eating, taking alcohol or beverages.
We have the classification of ulcer. We have anti-ulcer agents. These are drugs that are used in the treatment or in the management of ulcer. First, we have the agents that reduce the acid secretion in the body. First, we have the H2 antihistamine. Those are the famotidine, the ranitidine, the cimetidine. Then we have those actually. Then we have those called the proton pump inhibitors. Those are the azoles family. We have omeprazole, the lansoprazole, the rabeprazole. Then we also have the prostaglandin analog, which is the misoprostol. Then the second classification of ulcer, we have those that neutralize the acid in the body. Those are called the antacid. Now there are two types of antacid. We have the systemic and then we have the non-systemic. The systemic, we have the sodium citrate and then we have the sodium bicarbonate. Then for the non-systemic, we have the magnesium trisilicate. This is your mismatch, which we all know. Then we have the aluminum hydroxide and we also have the magnesium hydroxide. Now the third class of the anti-ulcer agents that we have the ulcer protective. An example of such agent is the sucralfate. Then the fourth class are the antimicrobials. Now these antimicrobials are just like they came into play recently because we have seen that they also help to they also help in the treatment of ulcer, because ulcer actually is implicated by an organism known as Helicobacter pylori. Now these antimicrobials, they help to manage them well. An example, we have the clarithromycin, we have the tinidazole, and then we also have the metronidazole. Thank you.
Mechanism of action of ulcer medication to make it relatable. There are mainly four mechanisms: reduction of gastric acid secretion,
neutralization of gastric acid secretion,
ulcer protective,
anti-H. pylori drugs.
Under the reduction of gastric acid secretion, we have the proton pump inhibitors, the anticholinergics, the prostaglandin analogs, and the H2 antagonists. The H2 antagonists basically work by blocking the binding of H2 receptors with histamine, because the binding of H2 receptors with histamine causes the release of gastric acid. So, blocking of this union will prevent the gastric acid production, thereby relieving ulcer pain. The proton pump inhibitors act by inhibiting the activities of the proton pump. Basically, when you eat food, the proton pump enables you, in order to digest the food, acids are needed to digest the food. So the proton pump basically just pumps these protons, which now inform the body to release these acids to digest the food. So when the proton pump is blocked, this gastric acid secretion is reduced, and thereby the ulcer symptoms are then managed. And anticholinergics, they work by blocking the actions of acetylcholine, which is a neurotransmitter which is involved in acid secretion. Then the prostaglandin analogs, they work by basically mimicking the activities of natural prostaglandin, which is mucosal protection, they aid in increasing mucosal blood flow, and also have anti-inflammatory properties. Anti-inflammatory properties basically means to reduce swelling and the pain that comes with it.
The neutralization of gastric acid in the stomach, just like we have friends who are pacemakers that love to calm down the situation of things, antacids work this way. They are basic substances that neutralize the gastric acid in our stomach. They do not directly decrease the production of this acid, but they raise the pH of the stomach, thereby neutralizing the acid in our stomach. They work through two main mechanisms, the systemic and the non-systemic. The systemic, they neutralize the gastric acid production in the stomach, working directly in the bloodstream. They first of all they digest this acid like sodium carbonate, magnesium carbonate, then they ingest it and dissolve in the stomach, releasing ions. Then these ions now neutralize the acid in the stomach. Then the non-systemic, also known as the local, they do not work in the bloodstream, but they have the buffering capacity. Then they increase the pH of the stomach and neutralize this acid. Anti-H. pylori drugs, they are mainly the antibiotics. Now the macrolide, example erythromycin, binds to the 50H ribosomal subunit, inhibits protein synthesis, thereby inhibiting H. pylori growth. Then we have the fluoroquinolones, example ciprofloxacin. They inhibit the DNA gyrase and topoisomerase, thereby disrupting the activity of the H. pylori, inhibiting the growth. Then we have the metronidazoles, like metronidazole and the metronidazoles. They form reactive metabolites that inhibit the DNA growth.
So the ulcer protective are also known as gastric protective agents, and they mainly act by mucosal protection. Mucosal protection occurs by forming a protective film or a barrier on the stomach lining, protecting it from acid, pepsin, and other bile salts. Then also acts by acid reduction, which is either occurs by the inhibition of histamine release, the inhibition of gastrin release, and also the inhibition of the proton pump. Then it also works by mucosal repair, which occurs by increasing the production of mucus, also increasing the production of other protective factors, increasing of the or enhancing the new growth of blood vessels, and also anti-inflammation. Thank you.
So I'm here to continue from where my colleague stopped, and I'm here to talk about the comparison between various combination therapy used in ulcer healing. And we know that in the types of combination therapy, we have the dual therapy, we have the triple therapy, we have the quadruple therapy, and we have the sequential therapy. In the dual therapy, we have a proton pump inhibitor, which example omeprazole and one antibiotics. In the dual therapy, we have a proton pump inhibitor and two antibiotics. In the triple therapy, we have a proton pump inhibitor and three antibiotics. Then in the sequential therapy, we have a dual therapy plus a triple therapy, which in a combination we have like two proton pump inhibitors and up to 4 to 5 types of antibiotics in that class, which will be taken sequentially 5 to 7 days each of the treatments. Then you should know that in the sequential therapy, whereby we have up to 4 to 5 antibiotics, it will be more expensive or more costly than the quadruple therapy, which involves just 3 antibiotics. And the quadruple therapy will be more expensive than the triple therapy, which has 2 antibiotics and a proton pump inhibitor. And the triple therapy will also be more expensive than the dual therapy, which is just a proton pump inhibitor and 1 antibiotic. Now, after having a H. pylori test, the test will determine the type of therapy which the person will undergo.
Before from where my paper left off, I'll be speaking on the types of combination therapy. Now, there are different types of combination therapy. You have the dual therapy, the triple therapy, the quadruple therapy, and the sequential therapy. Now, the dual therapy, as the name implies, is use of 2 classes of anti-ulcer drugs, which is the PPI, example omeprazole and amoxicillin. Then you have the triple therapy, you have the PPI, the clarithromycin, and the amoxicillin. Then the quadruple therapy, more than 3 classes. You have the PPI, the clarithromycin, the amoxicillin, and the metronidazole. Then the sequential therapy, which is use of the PPI, clarithromycin, amoxicillin, metronidazole, was over a sequence for a period of time. Now, what is the rationale behind this combination? For the dual therapy, the PPI and the antibiotics. Now, the work of the proton pump inhibitor there, which is the omeprazole, is to reduce the production of the stomach acids. Then the antibiotic there is to kill or eradicate the bacteria causing this infection. Then the rationale behind the triple therapy combination, which is the PPI, the clarithromycin, and the amoxicillin, PrEP-PAC, as the name of the drug, is to reduce the stomach acid production. Then for the clarithromycin, is a macrolide antibiotic, it eradicates H. pylori. Then the amoxicillin is a penicillin antibiotic, it also eradicates
H. pylori. Then for the quadruple therapy, the PPI, the clindamycin, the apostle, and the metronidazole, the protoporphyrin inhibitor here will reduce the production of this stomach acid. Then the antibiotics, which is the clindamycin, the amoxicillin, the metronidazole, they kill and eradicate H. pylori. Thank you.
Hi guys, my name is Obi Collins. I'm taking guys on choices that govern the preference of one ulcer combination treatment over the other. Number one, we have the patient previous history, we have drug resistance, we have patient compliance, we have patient intolerance or allergies, and we have H. pylori status. When we talk about drug resistance, we talk about how patient gets resistance to some of antibiotics like clarithromycin and metronidazole. So it's left for the pharmacist or the healthcare practitioner to substitute the antibiotics with another antibiotic that the patient is not resistant to. When we talk about patient compliance, we talk about the different doses in which the pharmacist prescribes the drug. Okay. The second one, we are talking about the patient previous history. In this place, we look at why. In this case, we look at the reoccurrence of the ulcer and why the medication given to the patients wasn't effective enough. So, with these factors or choices that I had mentioned earlier, it is very important for healthcare providers to take note of these factors in order to tailor each regimen according to each patient's needs. Thank you.
In conclusion, all these drugs work well when taken alone, but even better when combined, because then they can make up for the shortcomings of each other. This is why your healthcare practitioners help you in combining these drugs to know how we can meet your needs financially and even through your medical history, and to avoid resistance and everything that comes with taking drugs without medical advice. Thank you.